Hello, I'm Julia Walters with Kingman Regional Medical Center, and you're watching our COVID-19 update series. Our guest today is Sarah Brady, Director of KRMC's Intensive Care Unit. Before we talk with Sarah, I'll go over the most recent numbers. Today is July 21st, and we currently have 24 patients in the hospital related to COVID. In the past week, we've done 550 tests for COVID with 54 positive results, and our 30-day rolling positivity rate is 8.7%. Sarah, thank you for joining us today.
Thank you for the invite.
So we want to just talk about the general status of the ICU right now with the COVID surge. We have 24 patients in hospital right now. And how many of those are in the ICU?
10 of those are in the ICU right now.
Are we seeing general hospitalizations going up? Are they going down? Is the rate kind of steady? What are you seeing?
I would say over the last 3 weeks, we've seen a pretty drastic incline from where we were in the previous couple of months. We're certainly seeing that on the inpatient side with the amount of admissions that we're having for COVID and the amount of resources that we're having to utilize to care for a lot of these patients.
So let's go a little bit more into that. How are resources being impacted as far as staffing, space availability? What does it look like in the ICU right now?
So the ICU has 14 total beds, and with 10 of those being filled with COVID patients, it limits our availability for other critically ill patients. We have had to implement some of our surge plan in terms of staffing and resource utilization over the last month, which has definitely been a challenge for us and for our staff. And it's definitely an impact on us.
Okay, so can we talk about just the level of care that's required in the ICU and the reason we need these extra resources right now?
Sure. So the ICU stands for Intensive Care Unit, for those that may not know. And what that means is that the level of intervention that our patients require is much higher than outside of the ICU. So 2 patients typically have 1 nurse, an intensivist, an acute care nurse practitioner, a clinical pharmacist, therapy services, all kinds of resources we utilize to fully care for these patients, to look at every aspect of where they are in their health and where they are in their disease process. Multiple bedside interventions are required in addition to the PPE or the personal protective gear that we have to wear to be in these rooms. So all of that contributes to how difficult it can be to really care for patients in this type of setting.
Right. So that's a lot of people and management required for patients who are severely ill, right? So patients with COVID in the ICU, a good number of them are on ventilators. Is that right?
Yeah. If you have COVID and you reach a point where you need a ventilator, you're considered critically ill and need our level of care. Currently today, we have 8 patients who have COVID that are on ventilators in our ICU.
Sarah, is this impacting the morale of staff?
They are truly an incredible team that are here to serve their community. But with that said, it truly hurts our hearts that people get to this level of illness when there is something out there that can help prevent the severity of illness and prevent COVID patients from coming to the ICU. So I would just give a huge shout out to all of the staff that are serving in that department, as well as let our community know that there's something out there that you can do for your own health. Studies have shown and are showing that, the impact of getting a vaccine can only benefit. Obviously, there's still other things that have to take place, good hygiene, hand washing, masking, social distancing.
Of course, all the things we already know will be helpful. We should continue to do, especially as kids go back to school. People are gathering indoors more. So those are all good measures to take along with the vaccine. KRMC does offer the COVID-19 vaccine free of charge for people 12 and over. Kids 12 to 18 do require an appointment. So to schedule that appointment, please call 928-263-3945. If you're 18 and over, you can walk in Monday through Saturday, 8 a.m. to 1 p.m., and that's at 3116 Stockton Hill Road, KRMC COVID Services. I'm Julia Walters with Kingman Regional Medical Center, and this has been our COVID-19 update. Thank you again, Sarah, for being here with us. To learn more, please visit our website at azkrmc.com/COVID-19.